10 Early Signs of Prostate Cancer You Should Never Ignore. Did you know that prostate cancer is one of the most common cancers in men worldwide? The scary part is that it often develops silently, with symptoms so subtle that many men ignore them, until it's too late. Early detection can make all the difference between successful treatment and serious complications. In today's video, I'll reveal 10 early warning signs of prostate cancer that you should never ignore. Some of these symptoms might seem harmless, but they could be your body's way of warning you about a bigger problem. Stay with me until the end, where I'll also share key steps to protect your prostate health and when to see a doctor. Before we dive in, don't forget to like this video, share it with your loved ones, and subscribe to the channel for more straightforward science-backed health tips. 1. Frequent urination, especially at night. Nocturia. The prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. When cancer cells begin multiplying, the prostate starts enlarging and puts pressure on the bladder. This pressure leads to increased urge to urinate, even if the bladder isn't full, waking up multiple times at night to pee, feeling like you need to pee again shortly after going. At first, you might brush it off as drinking too much water before bed. But over time, the trips become more frequent, and the urgency becomes impossible to ignore. If you're getting up more than twice per night to pee, it's time to check your prostate. Stay hydrated but avoid drinking large amounts of fluids before bed. 2. Weak or interrupted urine stream. The prostate surrounds the urethra, the tube that carries urine out of the body. As prostate cancer grows, it starts squeezing the urethra. This partial blockage slows down urine flow and makes it harder for the bladder to fully empty. Signs to watch for includes: urine stream starts and stops mid-flow, takes longer than usual to empty the bladder, and a feeling of incomplete emptying. Why this is a red flag? Men often blame this on aging or a weak bladder, but if the problem persists, it could be a sign of a growing tumor pressing against the urethra. It only worsens over time. If you're noticing these changes, get checked immediately. Early detection can save your life. 3. Blood in urine or semen, hematuria and hematospermia. One of the most alarming yet often overlooked signs of prostate cancer is blood in urine, hematuria, or semen, hematospermia. Even if it happens just once, it's a major red flag that should never be ignored. As prostate cancer grows, it can 1. Damage blood vessels in the prostate, urethra, or bladder, causing bleeding. 2. Inflame surrounding tissues, making them fragile and more prone to bleeding. 3. Obstruct normal urine or semen flow, increasing pressure on blood vessels. And what will this look like? The urine will have light pink, reddish, or brownish discoloration. The semen will have rusty or blood-tinged appearance. Many men assume that blood in urine is from a urinary tract infection, UTI, or kidney stones, and blood in semen is due to rough sex or injury. But if the bleeding happens repeatedly or without an obvious cause, it could signal a growing tumor in the prostate. Even a single episode of blood in urine or semen needs medical attention. Your doctor may order a PSA test, urine analysis, and imaging scans to check for prostate cancer. If you notice blood in your urine or semen, don't ignore it. Early detection can make all the difference. 4. Pain or burning sensation while urinating. Cancer can trigger inflammation in the prostate and urinary tract, leading to irritation and discomfort when urinating. Many men assume this is just a UTI, urinary tract infection. But if it persists without an infection, prostate cancer could be to blame. If antibiotics don't relieve the burning sensation, your doctor may recommend a PSA test, prostate-specific antigen blood test, to check for prostate cancer. 5. Difficulty getting or maintaining an erection. The prostate plays a crucial role in sexual function because it helps produce semen and supports proper blood flow. When cancer interferes with nerve signals and blood circulation, it can lead to trouble getting an erection, softer erections than usual, loss of spontaneous morning erections. Many men feel too embarrassed to talk about this issue, but if erectile problems appear suddenly, it's worth discussing with a doctor. 6. Painful ejaculation. An inflamed or cancerous prostate can put pressure on the seminal vesicles, the glands that produce semen, making ejaculation uncomfortable or even painful. Signs to watch for: sharp pain during or after ejaculation, decreased semen volume. If this happens regularly, it's a sign that something isn't right with your prostate. 7. Unexplained lower back, hip, or pelvic pain. In advanced stages, prostate cancer spreads to bones, particularly in the lower back, hips, and pelvis. This can lead to deep, persistent pain that doesn't go away, pain that worsens when sitting for long periods, bone tenderness in the lower spine or hips. If you have chronic pain in these areas without an injury, your prostate should be checked. 8. Sudden weight loss without trying. Cancer cells consume your body's energy, leading to rapid weight loss, muscle wasting, and reduced appetite. The earlier symptoms includes losing more than 10 pounds without dieting, feeling full after eating small meals. If you're dropping weight without effort, it could be a sign that cancer is altering your metabolism. 9. Chronic fatigue and weakness. Prostate cancer can disrupt red blood cell production, leading to anemia and constant exhaustion. The signs includes feeling drained even after 8+ hours of sleep, struggling with concentration and focus, needing frequent naps. 10. Changes in bowel habits. As prostate cancer advances, it can press against the rectum, leading to chronic constipation, narrow stools, pencil-thin shape, difficulty passing stool. If bowel changes appear alongside urinary symptoms, it's a sign that the prostate is expanding and affecting surrounding organs. Don't ignore these signs. Now that you know the 10 early warning signs of prostate cancer, the question is, will you take action? If you've experienced any of these symptoms, don't wait. Schedule a checkup. Your health is in your hands. Your body always gives you signals when something isn't right. It's up to you to listen. Prostate cancer is highly treatable when caught early, so never ignore these warning signs. Here's what you can do today. Stay proactive. If you experience any of these symptoms, don't wait. Schedule a checkup. Maintain a prostate-healthy diet. Eat more tomatoes, broccoli, green tea, and nuts. Exercise regularly. Staying active reduces inflammation and promotes prostate health. Get regular screenings. If you're over 50 or 40 with a family history of prostate cancer, routine PSA tests can help with early detection. If you found this video helpful, please like, share, and subscribe to stay informed about your health. Your prostate health matters, don't ignore the signs. Take care of your health and I will see you in the next video.